it's premature for anybody to say we'll open at this time. So I don't want to say that.
That's the minister's admission that the resumption of the school calendar remains uncertain. She said this while releasing the 2020 primary leaving examination results at State House Entebbe last Friday. According to Professor Anthony Mugagga, a professor of Education Foundation and Management at Makerere University, and Dr. Tony Mukasa Lusambu, the technical advisor of Uwezo, the ministry is not to blame for a blanket statement following the lessons already learned in dealing with the pandemic.
The post-previous COVID lockdown, both parents and schools made salient mistakes. One, the parents returned children to school who probably were sick. And the parents could not reveal that the children were sick. But at the same time, schools accepted children back to school without testing them for COVID. And at the same time, the teachers were not tested for what? For COVID.
Certain things may be able to open, but maybe schools might be difficult to open immediately after the 42 days, because the school is a complex institution where it's very, very difficult to block and say now students enter, nobody else should enter.
However, the statement disheartened Habiba Naule, a mother who has been struggling to ensure her 5 school-going children continue to have physical lessons with teachers at home and online. Naule thought it was a temporary arrangement and has been paying 20,000 shillings for each child every week, but the situation has become impossible for her to continue doing so.
We don't have that money because we are not working.
Yes, I don't feel good because we've been hoping to go back soon, but as if COVID is still increasing.
What we do now, parents, keep the children, keep the learners, make sure your children are really guided properly, keep them busy throughout. Don't allow your children to loiter all over the place.
Edward Kabali, a teacher who has been conducting online classes and physical teaching at different homes, has reported a big fall in the number of parents willing to pay for their children to continue having lessons.
And as I speak right now, many of them are now off the platforms, and we have like 3. So parents are no longer working, so they're not able to pay for the services.
The advice to the teachers is to say, teachers and the pupils and learners, please get to understand that learning continues. Learning continues. First of all, right now there is learning going on through different approaches. Secondly, schools shall open.
Professor Mugagga would like government to ensure there are statistics about vaccination and testings before reopening.
But I'm very sure no one has that data, that statistics. For example, who knows how many children fell sick, how many recovered, and how many are recovering? Or how many parents got sick because of the children coming back to school, from school, and have recovered, and how many have died? Now, all those things need to be looked at before we can substantively open up the education terrain.
The situation I envisage that would be very ideal for ministry to be certain and say, yes, we can now open schools, is a situation where all the teachers have been vaccinated, for example, where all parents who have access to the schools have been vaccinated, where those service providers have been vaccinated.
The other way forward is to continue promoting online learning.
But there is a constraint of data. The constraint of parents not working. The constraint of parents being sick or post-COVID sickness trauma.
Members of Parliament kindly help us to bring proposals to appeal to the government to reduce the data charges.
Professor Mugagga and Dr. Lusambu have a time frame in mind when the schools should reopen.
All these things, we need another about 3 months. Unfortunately, the best time is to tell parents the truth that we shall reopen up schools in January next year, so that the anxiety goes away.
Patrick Senyondo, NTV.